Minister of Health.
Mr. Speaker, thank you very much. Yesterday, the member opposite stood in this House and made put rumors on the floor of the legislature.
Rumors are no
Mr.
good.
Speaker, and members opposite and leader treated it and tweeted it as if it was fact. Mr. Speaker, I'm going to clear and tell you the facts here today. Through the Department of Health, it was verified by Horizon and Vitality, 0 pediatric code blues since December 1 for children under the age of 3. There were 0 pediatric deaths in hospitals since December 1 for children under the age of 3. So this means there were 0 pediatric deaths for children under 3 due to RSV or influenza-like illnesses. Mr. Speaker, if the opposition wants to help, they should stop spreading rumors and innuendo here in the floor of the legislature and then going out in the public or retweeting it. These are the facts, Mr. Speaker. This is what's getting done.
Deal with facts. Minister of Health.
Well, Mr. Speaker, thank you again. And the member opposite acknowledged that it was a rumor. But, Mr. Speaker, when the leader from above talks about the tweet, treats it like fact. This is deeply disturbing and wholly heartbreaking. Mr. Speaker, that's as if it was fact. Mr. Speaker, it was a rumor, and it's unfortunate that members opposite continue to perpetuate these rumors when, in fact, there are good things going on. Mr. Speaker, we know that there's lots more work to do, and we're prepared to do that work. But let me tell you some of the changes that have occurred in the emergency rooms here in the last little bit since the unfortunate events occurred. There are now 2 triage nurses in the emergency room. There are patient monitoring individuals in the emergency room. The RN rotation is now trying to accommodate for peak hours in the emergency room. There's social workers avoiding some social admissions in the emergency room. There's a diversion clinic here in Fredericton to take the levels 4 and 5s to the clinic and not the emergency room. And there's weekend discharge happening right now.
Minister of Health. Order, please.
Well, Mr. Speaker, it's unfortunate that the leader here on the floor hasn't taken the direction from the leader above to not have personal attacks. I understand that the leader above wants to improve the decorum here on the floor, and the member opposite just went with a personal attack. Mr. Speaker, there's significant initiatives that have happened since the summer started, and I had one just the first of this week where and it was the member statement where 360 additional knee replacements will be done in the Upper River Valley Hospital. Mr. Speaker, that's part of our plan, access to surgery. We're reducing the wait line and the wait time of people waiting for knee surgeries. And, Mr. Speaker, they stood against Motion 3, which is actually, again, reducing the wait time and the wait line for cataracts, which will free up room in the emergency room, or sorry, the operating room, which will, again, be now available for knee, hip, and cancer surgeries. Mr. Speaker, that's action. That's getting the results. That's not just